Hello everyone, once again welcome to my Oet channel. So today's video is related to exam oriented students. So those who are going to attend exam, I hope this video will be helpful. So first I will start with the writing. So when you are going to write the letter, just keep three things in your mind. So I want to tell you four things. The first three things are related to present medical paragraph. So there are some different types of questions in this 2022, and this is going to be a twisting questions. So almost you will get some confusion somewhere when you are writing the present medical paragraph. One question, it is related to multiple cases. If you have multiple cases, like two cases, example like Parkinson disease and depression, so it is sometimes it may be related, sometimes these questions or conditions may be irrelated. Something it's happened before the admission, something may happen it's during the hospitalization, whatever. If you have two cases, not that two diagnoses, if you are to write it in introduction, keep it in your mind. Make two paragraphs in present medical paragraph. That medical paragraph can be divided into two. In the first paragraph, you can mention about one disease condition and the cause, how it happened, and what is the management you have given, and what is the current situation. And next paragraph, you can write about the next condition. And in that second paragraph, at the end, you can just give a sum. What is the overall status of the patient? So like that, we can sum up in that situation. Another one, if you have known case, if you have known case letter and there are some old history they have given, and it's followed by home visit, so how we can write? Always in present medical paragraph, the first paragraph make some stories from the starting. When the condition has started, you can start from there. Then you can come to the second paragraph. In the second paragraph, you can just start with the home visit. So what you have to do in the end of the first present medical paragraph, you have to mention why this home visit has been arranged. And in the next paragraph, you can write all related to home visits. At the end of that paragraph, you can write what is the current status and why you are requesting the letter. It is like a simple sum up. So that is the second one. And another one more thing, it is related to urgent letter. So if you want to write urgent letter, always according to the updates, always start with the today's case. That means today's part, today what happened. So when you are writing today what happened, mostly it will be home visit. So you can just start with how the home visit, or for what the home visit has initiated under your nursing service. Then you can tell, that is only one sentence. Then you can continue with today's incident, what are the things that's happened. Then at next paragraph, you can just start with the old history. If there is like old history, means start with initially. Okay, initially, these are all the things happened. And at the end of this paragraph, you can just come to home visit. Therefore, he has been arranged with our home visit. So these are all the three things I want to tell you regarding the present medical paragraph. Then the fourth one, I just want to tell you regarding the introduction. So introduction means mostly you will not get confusion, but in some cases there will be two conditions. So that is the thing you will get confused, whether we have to write two conditions or it will be only one. So like that. So always see the recommendation. It will be easy for you to find out. In the recommendation, just you can see what all the recommendations are given. Example, if it is related to two conditions, that means you have to write the two conditions in the introduction. If it is related to only one, so mostly the present medical paragraph itself, we can give the importance for other conditions. But presently, currently, what all the conditions are there for the patient, still we need some assistance. So according to that, try to make the introduction paragraph. So in introduction paragraph, don't write always the diagnosis. Sometimes diagnosis they will give and the surgery also. So no need to write the diagnosis. There you have to write the patient is recovering or recuperating from that surgical procedure. So always keep it in your mind. In the introduction, you are going to write recent present condition, not always the diagnosis. Sometimes it can be the diagnosis, but most of the time it will be like recuperating, recovering, or has been diagnosed, or sometime only you can use has and all. And sometimes you may get confusion whether you have to use has been or you have to use was diagnosed. Has been diagnosed means for the recent recently, if it is diagnosed, you can write has been diagnosed with. If it is very old condition, you can just write was diagnosed. And then one more thing I want to explain you, that is important point in present medical paragraph. Example, there is one condition, but it is like exacerbated condition or worsening, but this condition is already there for many years and patient is on medication or treatment. How we can start? Always start in the present medical paragraph with the has had. Example, Mr. X has had chronic obstructive pulmonary disease since 2016 and on this medication. But today what happened? Today also patient has the same problem, but it is like an exacerbation of COPD or infective COPD. So something it can happen. Alzheimer's disease or Parkinson disease, or can be hypertension, diabetic, or whatever, like a chronic condition, renal failure also. So something is happening like a worsened version. That is today's case note. Means always that the past history you have to write it in the present medical paragraph with has had. Okay, Mr. X has had this condition since this year and he is on this medication, and start with then again continue with recently. Recently on this date patient presented with this on, like that you can sum up. So these are all the things it is related to writing. So I hope this video is helpful for you. I will make another one video for speaking. Don't miss that one also. I will come back with that one. Until then, bye. Take care. Hello everyone, once again welcome to my Oet channel. So today's video it is regarding Oet speaking. So how you have to prepare your mind for the exam. So those who all are preparing for your exam in the last moment, I hope this video will be helpful for you. So if you want to get B score in speaking, there are some criteria you have to keep it in your mind. First of all, we have some set of role play cards which will be fixed for all exam. That means we have speaking cards for community health center. In that the topic will be mostly regarding vaccinations, or mother is coming, or parent, any mother or father coming to the clinic to get some information regarding baby's problem, or like regarding parents, children they are coming, son or daughter is coming to you, they will ask you some concern regarding their parents problem. So these are the things it will comes under the community health centers. It can be known case or unknown case. So what do you mean by known case and unknown case in speaking? So some of the students until now they don't have any idea about this one. So I will tell you regarding the known case mean, you can read the note before the writing. I mean before the task, the speaking task, there will be one scenario like a note they used to give. Don't skip that note. If you will skip, you will not get exactly the introduction for your role play, or else you will not get exactly the content of the role play. They will give you a clear idea. So what is your role and who is in front of you. And main thing you have to see, you have just examined. So the phrase if it is there means, that means this is a known scenario. That means already you have started your conversation and it is in the on the way of conversation. In before that you have just examined patient's body part, maybe eye or face or injury part, wound part or ear or something like that. So that means no need for your self introduction. There what you have to do, you have to ask their name during 3-minute preparation time. Don't wait for them to tell to start the conversation. Just if you find out this is a known case means, you can just ask them how may I address you during the role play, and write a name on the paper. So they will provide you the question paper. You can write it over whatever you want, you can write it over the paper, but you have to give back them. So you can just write the patient's name. Sometimes this is mother and baby. Maybe baby is not present. Maybe is not present. If it's given like that means no need to ask baby's name. Just you have to confirm baby whether baby is baby boy or girl, because you have to mention him or her during your conversation. And another one more thing, if baby is present means you can ask patient's name and baby's name during the conversation, not before, during the conversation. If it is given, you have just examined the baby means you have to ask mother name and baby's name, because it is very easy for the introduction. Example, if the baby is there, you have just examined baby's leg, something happened. So you have to start the introduction. How we can start? During 3-minute preparation time, you have to ask parent name and baby's name. Example, parent name is John, baby's name is Tom. So how we can start? Well, Mr. John, thank you for allowing me to examine your baby's leg. So that is introduction. Then you can straight away start the task. So this is the way how you have to handle known case and unknown case. So this scenario mostly it will be there in community health center, or sometime it will be there in emergency department also. Then another one more thing, it is a hospital. In hospital you have different variety of role plays, but you can just think that one, it is admission, maybe hospitalization. Hospital means of course it is like during hospitalization only. So you know the patient, you know regarding the patient's name, everything, condition, everything you know. So what you have to do during treatment preparation time, you have to just ask patient's name. And in the introduction you can just self-introduce, but you should not ask patient's name because it's already hospitalized patient. Example, good morning Mr. John, I am Rashmi Rajan, one of the registered nurses working in this hospital ward. How are you feeling now? So like that, in casual way you can continue the conversation. Another one more thing, it's like newly admitted patient. Example, newly admitted patient, and if you want to give some if you want to give injection or something like invasive procedure, means you need to confirm whether this is the patient from your prescription chart or something. So what you can ask for the confirmation purpose, may I ask your full name and age or date of birth, something like that you can ask, but don't ask that how may I address you or what is your name, like that. No, it should be for the confirmation purpose. May I ask you your full name, or could you please tell me your full name and date of birth or age or something like that we can ask. So mostly hospitalization you will get, especially for discharge discussion. So discharge discussion means maybe patient is going to be discharged. So it is the end of the hospitalization. So you can just start the conversation same in that way. And in this conversation, at the end of the conversation, how you can conclude means you can ask, do you have any concern? So if patient is telling that, I know I don't have any concerns, sister, everything is clear. Then you can tell, yes, Mr. John, I hope I have clarified all your doubts. If you don't have any other clarifications, may I proceed with your discharge process? So that is our conclusion. No need to tell, if you need anything, please press the bell or buzzer. No need there, because this is discharge. Next, you are going to discharge the patient. But if it is the not discharge, it is like a normal scenario, means you can end up in it that well, Mr. John, thank you for not thank you for something according to the role play card. The ending will be something, thank you for accepting my advices, or thank you for your informations, or you can just inform that I hope I have clarified all your doubts. If you need any assistance, please press the bell, call bell, I will come and assist you. This is for normal patient. And even in hospitalization you will get parent conversation. Parent conversation also can be two types. Baby is present, baby is not present. Baby is present inside the medical ward. Okay, it is not the clinic, hospitalization. Baby is already got admitted. You are talking to the parent. If it is baby is not present, means mother is outside or father is outside of room. So you don't know regarding the parent, whether they are parent of this patient or no, you don't know. So what you have to do during conversation, at the introduction, you have to start, if I am not wrong, is it, example, baby's name you have to ask, supposed to be asked. So what you have to do in 3-minute preparation time, you have to ask baby's name, that means your patient name. Example, baby's name is Rose. So how we can start? You don't know mother is standing outside. So you can ask like this, good morning. You can just introduce yourself. Myself, Rashmi Rajan, one of the registered nurses working in this hospital ward. If I am not wrong, is it baby Rose mother? Like that we can ask. Then mother is telling that, yes, I am. Then you can ask them, how may I address you? Then you can continue the conversation. In another scenario, baby is present and you are talking to the parent inside the ward. So that means you don't have any confusion regarding the patient. But maybe you don't know baby parent's name. So in this scenario also, you have to just ask during the 3-minute preparation time, you can just ask baby's name. Even you can ask mother name also, because it is hospitalization. Maybe you will be familiar with the mother also. So like that also, it's like optional, you can use. But if baby is not present, means you are not confirmed with the mother. So you have to ask their name during conversation only, but mother baby's name should be asked in the 3-minute preparation time. So that is another one scenario. Then another one scenario is vaccination. You may get vaccination for adult or vaccination for babies. So vaccination for babies means you are talking to the parent and you don't know regarding their histories and all. So like a normal way, you can just start talking. And adult vaccination also is like that only. There, so both in immunization there will be more concern regarding the side effects. So there you have to give more reassurance. So that is the thing. In this scenario, at the end of the conversation, the conclusion should be, if you don't have any other clarification, just you can start like this. I hope I have clarified all your doubts. Then if you don't have any other questions, may I proceed with the vaccination? So that's enough, because you are going to give the injection. No need any other conclusion. Sometimes parent will come to you just to get an idea about the vaccination. In that scenario, it's okay, fine, you can talk. You can tell like this: thank you for visiting us, and if you need any other information, please do not hesitate to contact with us. This is the contact number of our clinic. Like that you can sum up. So according to the scenario, the introduction and the conclusion will be vary. Then the totally different role play card is home visit. Home visit means, of course, there it will be like a starting. It can be two types. Either one, it will be like a newly you are going to the home. Another one scenario, it's like a known case. You have just examined a patient, like that also. So if it is unknown means, like you didn't start the conversation, means always start with the greetings. Good morning. Wait for them. Whatever the role play, just I could see that some of my students, they are doing like that only. That's why I'm just sharing with you. After greeting, stop your conversation. Good morning. Then just wait for them, the return back. They will tell you good morning. Then you can continue. The first thing should be the introduction only. Always introduce yourself, then go to the next conversation. So you can just like this: good morning. They will tell you good morning. I'm Rashmi Rajan, one of the registered nurses from your local community area. Then you can ask, if I am not wrong, is it Mr. John's house? So what you have to do during 3-minute preparation time, you have to ask patient's name in case of home visit. Okay. Then, is it Mr. John's house? If I am not wrong, is it Mr. John's house? Then they are telling that yes, it is. Then you have to ask, am I talking to the right person? Then they are telling, yes, I am Mr. John, like Johnson or John. Then the next thing should be your purpose and permission to talk. This should be together. Purpose of the visit plus your permission to continue the conversation. Example, you can tell that, glad to see Mr. John. Actually, I came here to know about your post-operative period. Is it the right time to talk with you? That means your purpose plus the permission to continue your conversation. The patient may tell that, yes, sister, of course, you can come inside. Thank you. Then you can continue with the task. So this is the peculiar introduction for home visit. And at the end of the home visit, of course, if it is like a continuation of care, means you can tell that, thank you for your time which you spent with me. And meanwhile, if you need any assistance, you please do not hesitate to contact with us. We are there to help you. That's enough. An example, if you went there for any vaccinations or any injections, it is like a single home visit. You will not continue with any more, means you can just sum up that, thank you for your time which you spent with me. Have a nice day. That's enough. Okay, so you can sum up. In that home visit itself, there will be non-scenario. That means you have just examined patient. They are actually the same thing only. There is no need for the introduction. You can just ask the patient's name during 3-minute preparation time, and you can just straightly you can ask. Example, patient's name is George. Miss, well, Mr. George, thank you for allowing me to examine or something. Then you can start with the conversation. Conclusion will be same thing only. So only one thing you have to take care, whether it is non-scenario or it is a unknown scenario. So these are all the common talk. Another one more thing, it is emergency department. So in emergency department, it is like a panic situation. It's like emergency cases only. So no need for like a elaborate introduction. You can just there also you have to take care whether it is non-scenario or unknown scenario. If it is you have just examined this, it is non-scenario. You can just ask their name during 3-minute preparation time, and during the conversation you can just start with, well, Miss Maria, thank you for allowing that thing will go. And if it is unknown scenario, means you can just self-introduction, greeting, self-introduction, then it will continue like good morning, my name is Rashmi Rajan, I am the emergency nurse for you today. That's enough. Then you can continue, how may I address you and how can I help you today? then you will continue with the other task. So these are all the important task or role play cards which will appear for all exam. That means community health center, then hospital scenario, hospital ward, emergency department, and home visit. So in that clinic also can come. It will be same like a community health center. A different variety of clinics are there. So in that clinics, they will come to get some information regarding the procedure. So that procedure is important. One question will be related to any procedure. So you have to explain the procedure and the indication, contraindication, and the side effects, exactly what is the procedure involves, and aftercare, the discharge. So all these will come. In that, just keep it in your mind. There are two words, that is resist and warn. If you see these two words, keep it in your mind. Don't forget to ask, do you have any concern before that task? Okay, warn means what? You are warning not to do or don't do. These things only will come, but don't use that word. These things only you are warning to stop something, not to continue like that. Resist means once you are telling, no, I could not. So that is the meaning. In these two situations, if you didn't ask any question, means we could not complete that task. So you have to ask, do you have any concern? That patient will ask you something. Then you are giving the warning. How you have to give the warning? Don't tell that. Don't use. Okay. Don't. You should not. You should not. You never do. Not like that. In simple way, we can tell that. Mr. John, I can truly understand your concern, but really, I am not the right person to explain you regarding this one. But no need to worry, doctor will help you with that. So this is the thing for like a warning or resist. Example, resist. Example, they are asking about pain medication. The patient is asking, sister, I am not getting any relief in my pain. So could you please administer me any strong painkillers? Then we can tell that, oh, I'm sorry to know that you are in severe pain, Mr. John, but really I'm sorry to inform you that I'm not the right person to prescribe any medications, but no need to worry. I will inform your doctor, let him examine you and he will prescribe the strong painkillers so I can administer you. So that is the way. Then warn means just you can tell that don't use, don't do like that. Example, you can ask something, do you have any other concern? Then patient is asking that, sister, is it okay to continue with the swimming if I have ear infection? Then we have to tell that it's not advisable. Then how we can tell, so John, I can truly understand your concern, but I am strongly recommending you to avoid swimming. Okay, it is strongly advisable and it is like highly recommended, and please try to avoid swimming. In that way we can express our warning, like it is essential for you to avoid, it is important for you to avoid, it is vital for you to avoid, it is advisable for you to avoid, or I'm strongly recommending you to avoid. These all phrases you can use for warn. That means you are warning them not to do. So don't use you are not, we can use even you are not supposed to do. That one also it's okay. But don't try to use the word don't do. You have not, these things and all, it is like a demanding sentences. So you cannot use in that OET role play. Because you can use, but if you are using, like the presentation will be demanding. So there is a less chance to get B score. So these are the scenarios will come for your exam, of course, and the first role play will be somewhat small, like home visit or a community health center or clinic or something like that. So you will get enough time. But the second role play will be some large content. You can see the task plus subtask will be there. So what you can do, during a treatment preparation time, whatever things you are asking, maybe patient name or baby's name, whatever, you can just write it on the paper. And introduction also, you have just examined. If it is written there, means just underline, don't forget, because you will prepare nicely, but when you will start your conversation, you will forget. Then again, you will start with the normal role play. So that is a thing mostly all students used to have this mistake. That's why I'm telling you to underline. No problem, you can underline that paper. If you have doubt, you can ask to the interlocutor before starting, may I use this paper, whether they can write something over there. You can just ask them and confirm them, and you can make use. Then important thing, don't underline all things, like important things like word, explain what is the content to explain. Want means what is the thing you have to want. Resist means what is that resisting. And you can see that in second role play and all, you can have more subtask. So you will get confusion because you are maintaining eye-to-eye contact with the interlocutor. So what you can do, each important thing you can underline whenever you will do. Once if you finish your subtask, you can just put tick mark in the side, left side, in the subtask, not in the main task also, so that it will be easy for you to confirm yourself that how many topics you have finished and how many is remaining. Sometimes your interlocutor may ask you without order, so you will get confusion from where I have to restart. So that thing will come. And sometimes if they are asking something, means don't leave it. What is their question? You have to answer first, then you have to go into your track. So these are the things, if you keep it in your mind, the speaking will be very easy and easily you can get B score. And maintain your politeness. Always maintain your politeness and respect. Then the flow, there should not be any gap. So what you have to do in 3 minutes preparation time, you have to read thoroughly and underline the things. Then when you are doing the conversation, just you can put tick mark in the side which one you have finished already. Then the another important thing it is that warm-up questions. Actually, warm-up question, nothing to be worried. They will ask you maybe 4 or 5 questions. So if you want to get some questions, I will give the link in the description box. You can see, you can write and practice. And always just to try to practice by yourself or record or something, keep it with you. Then before going to the exam, just have a quick look over your speaking notes. Maybe you will write something like warm up or some what are the connectives, especially maybe you will use the connectives, sympathetic words and all. So for sympathy, I can tell you that always you can. So what is the problem is students, they have they know how to or what to tell in that situation, but a sound modulation will not come. So most of the students, they have these issues, but just try in that way. Example, patient is telling that, sister, I have severe pain over my leg, I can't move at all. So what you have to tell as a nurse, example, patient's name is George. Oh, Mr. George, I am really sorry to hear about your pain, but no need to worry, I am here to help you. This thing, it will not be there in your role play card, but you have to tell by yourself. So this is the way how you will impress the the evaluator. So this is like a tricky only, but if you follow all these measures, it will be easy for you to get the B score. And one more thing, it is that patient is like especially to the parents and daughter and son of a sick parent. In that situations also, you have to be more sensitive, like sympathetically you have to talk, like reassurance should be there. Don't see the reassurance in your paper, only those area you should not use the reassurance. Reassurance can be any time, like in the introduction, at the end, or if they are telling something emotional, if they are expressing some concern, means you can tell, no need to worry, Mr. George or Calvin or Johnson, we are here to help you, no need to worry, we can move with that. So like that you can give the reassurance. And the connective, which one you are using the last also should not be repeatedly. Are you getting my point? Is it clear for you? Am I clear to you? Do you have any concern? Then how does that sound? But how does that sound? You could not use in everywhere. Example, if you are giving some advices, you can ask, how does that sound? How you are feeling about that? Do you think you can do that? This all meaning same thing only. And at the end, always ask them, is everything clear for you, or do you have any more concern to be clarified? So that should be there. Then only you have to conclude your role play. So second role play, you have to be some more faster than the first role play, because you can see the question paper, the content will be some more, so you have to maintain the speed. So if you follow all these measures, of course you can get B score very easily. I hope this video is helpful for you. Please follow all these advices, and I wish you very best of luck for your exam. Don't be panic. So I can tell you that everybody will become panic during the exam, but don't show it outside, because if you panic, your sound will show that you have some low confidence. So don't show outside. Just imagine that this is patient. They don't know anything regarding medically. You are the medical person, so you can talk whatever you will talk. They will not resist you. They will just tell yes, okay. So that's enough. So we will see with another one informative video. Until then, bye. Take care.